If you're having some discomfort or pain around the shoulder and you're looking for a remedy, I'm gonna go through a 4-step process to help with some of those symptoms of that pinching pain on the front top side, a little bit of that back of the shoulder or mid shoulder blade pain in these next 4 posts. I'm gonna be going over step 1, which is a self-massage desensitization. Step 2, stretching. Step 3, strengthening. And then finally, movement, which ties everything in together. A lot of the times, the shoulder girdle and the shoulder movement can be affected by tissue around the shoulder and how we choose to move. So I'm gonna be going through a series of 4 videos that allow me to share with you some common patterns and faults that maybe you can try and see if they're helpful to you. Step 1, and that's gonna be a self-soft tissue mobilization or desensitization using a ball. I'm using a lacrosse ball because it's a little tackier and more firm. However, it depends on your sensitivity or pain. You may not want to use a lacrosse ball right away. Maybe use a racket ball, tennis ball, something with a little more give to it that's a little more forgiving, if you will. But once again, all of these things are going to be to your tolerance, and you're going to be listening to your body because it will let you know when enough is enough. So what you're going to do is take this lacrosse ball, and there's going to be 3 areas we're going to target. The first area is going to be the pec muscle in the front. The second area will be the rotator cuff muscles on the back side of your shoulder here. And the third area will be the shoulder blade right through here. Those shoulder blade muscles sit on each side of the spine. So we're going to be using a ball to target those areas. So first, number 1, the pec muscle. I'm going to be using a yoga block in order to get me off the wall a little bit, and it makes it a little easier to use the ball for the pec muscle. So our target tissue is going to be the pec muscle, which is right here on the front corner portion of our shoulder. So I just place the block on the wall, place the ball right on that pec muscle, and I'm going to lean in on it. It's not the most comfortable mobilization here. Just slide back and forth, up and down, all along that pec muscle. Do it to your tolerance. I'm just leaning into the wall, adding pressure to that muscle, which should help improve the tension in it. Good. I'd start with a minute, build up your tolerance from there, but by all means, just listen to your body. Number 2 is the posterior rotator cuff muscles. I'm going to ditch the yoga block. With the ball, I'm going to place my hand over my shoulder and place the ball just behind the shoulder, just like that. My whole target tissue is going to be this area on the back of my shoulder. Take the ball, cross your arm, lean in on the wall. And I'm just going to rotate towards the wall and away from the wall, just exploring the entire back side of the shoulder there. If I find an area that's tender, I'm going to spend a little bit of time on it, trying to desensitize it. I'm going to do little circles. I'm going to go back and forth. I'm going to lower the ball to get on that bottom side so I can get underneath as I lower my body down. And you're just explore that entire back side of the shoulder there. It's an easy way to desensitize that area. Perfect. Now, for number 3, I'm going to use a pillowcase for this because I really don't like chasing the ball around. So let me grab that. All right, I grabbed a pillowcase. So what I'm going to do is just drop the ball right inside the case. So now you got a ball in a case, so you don't have to chase it all over the place. Our target tissue is going to be these muscles right between the shoulder blades. So go ahead and just drape that right over. Lean in on the wall. So I'm not on the spine, I'm just off to the side of it. And I'm going to go up and down and also sway left and right. And I'm just going to explore those shoulder blade muscles. If it's not tender and you're doing okay with this and you want to ramp it up, cross that arm around and it'll expose a little bit more of those muscles. Be careful doing this just because it really does increase the intensity. But in the end, just listen to your body. It's going to let you know when enough is enough. But however, here in the clinic, we typically start with 30 seconds to a minute and then build up tolerance from there. Don't be too aggressive with this. If you do like that deep pressure, by all means, you know your body best and what works for you, you do you. But if you're just starting off and learning this technique, I would definitely start on the lighter side and build up from there so that you're not running into too much soreness after treatment. As far as a rule of thumb, if you're a little sore for about a half of a day, maybe even a day following it, that's okay as long as it's relatively minor. If you have a lot more symptoms, that was too aggressive. So, hope this was helpful. We just went over 3 target areas: the pecs, the posterior rotator cuff muscles, and then the mid-trap and shoulder blade muscles. We are working on a soft tissue mobilization or massage using a ball or something to provide that deep pressure. So coming up in the next future posts are going to be regarding stretching for step 2, step 3, strengthening, and step 4, tie it all in together with movement. So once again, I hope this was helpful. Stay tuned. I've got more coming your way, and I'll see you guys in the next one.